Hello, I'm Dr. Israel Barkin, the Medical Director of the Prostate Cancer Research and Education Foundation, and today I'm going to discuss a new clinical study which relates to a very close subject to my heart, namely cryoimmunology. So let's go to clinicaltrial.gov and let's discuss the upcoming new clinical study, and here we go. Phase 1 clinical trial of cryoimmunotherapy against prostate cancer. As you could see here, this is a record 3 out of 11 that relates to cryoimmunology in other organs and different stage of development of the clinical trial. So let's go now and see. First of all, there's a very important number for you to jot down, NCT 024-23928. This number is the clinicaltrial.gov identifier. You could see that it was received recently, April 15, 2015, and it's just about recruiting patients to start the study. I'm aware of the fact that the first patient already went through. This study is actually not the first attempt to do it. I'm aware of a similar study done at Manila a number of years ago, and an attempt also in this country to do it, but for some reason there was no enthusiasm to continue and do the study, and now the Norwegian picked up the flag of cryoimmunology, and let's go and see what is this phase 1 clinical trial is all about. As you could see, the sponsor are Elden Cancer Therapy 2. It's from Haukeland University Hospital in Norway, Norwegian Radium Hospital. I had the pleasure to visit that place. Amazingly enough, I talked with the father of the principal investigator a number of years ago, like 25 years ago. We discussed those issues, and finally his son gets to start the cryoimmunology first study in Norway. So let's see what is the purpose of this study. They are going to take 20 patients with invasive castration-resistant prostate cancer. That means that they have advanced disease. Radiographically, it's verified that the patient has metastasis in order to join the study. The study incorporates the dendritic cell-based immunotherapy. So let's stop a second here. We all know that immune therapy has a new appeal, and it's being tried in some of the clinical trials. So it makes a lot of sense to combine the cryosurgery with immune therapy, since we all advocate combination of immune therapies. Cryosurgery by itself historically had some evidence in the laboratory and some clinical evidence that there is some effect on metastatic disease. But this is now an attempt to try to study it and verify it by a new clinical study. And let's go and look at the study itself again. So it's a combination of doing cryosurgery with giving the dendritic cells, with giving cyclophosphamide, which is a weak, small amount of chemotherapy that affects the immune system in the following manner. It depletes the T regulatory cells. The T regulatory cells are cells that are actually trying to stop the response of the immune system, and cancer cells learn how to influence the T regulatory cells to be on their side to stop the attack from the immune therapy. So this is combination of the cryotherapy itself with the dendritic cell, with giving a medication that will stop the T regulatory cells. And also we have here the ipilimumab, the anti-CTLA4 that we discussed it in previous video blogs, and that comes to stop the CTLA4 to encourage the Treg not to participate in inhibition of the immune response. So how is the study done? So as you see in the detailed description, the study treatment of the dendritic cell will be injected into the prostate following cryoablation. it is speculated that the antigen from the cryoablated cancer will be available in the vicinity of the cryoablation field immediately following the procedure. So now the cryosurgery created a situation where antigen are spilled into the microenvironment where the dendritic cells get from that menu the antigen to try to prepare antigen presenting cells to present it to the T cells to go after the cancer. So the idea is to bring the dendritic cells into the battlefield, sort of speaking, instead of preparing dendritic cells outside of the body for common antigen like prostatic acid phosphatase. Here we feed the dendritic cell with antigen that belong to the patient specifically. So the ages of eligibility for the study are 18 years old or older. The patient has to be male. Let's go quickly over the inclusion criteria. The patient should have castration-resistant prostate cancer. That means the patient already had metastatic disease, and the treatment is done not at the site of the metastatic disease. The treatment is done at the site of the primary tumor in the prostate, with the hope that by creating kind of vaccination, the immune system will go after the local cancer and also after the systemic cancer. So these are the inclusion. You have to have metastatic disease. Patient must be ambulatory. No contraindication for MRI. Must be able to undergo surgical procedure, must be 18, and must have some basic lab values that show that the patient is healthy enough to undergo this procedure. The exclusion criteria. History of prior malignancy, it's quite common. Treatment of any other investigational medical product within 4 weeks prior to administration of our drugs. Adverse reaction to vaccine such as anaphylaxis or other serious reaction. History of immune deficiency. Significant cardiac or other medical illness. Active infection. Non-hypersensitivity to any of the components of the cell therapy product. Patient who tests positive for hepatitis B and C. These are quite routine exclusion criteria for any clinical study. Now comes the practical point that I would like to share with you as viewers. Contact and location. Here you have the contact information of the doctors that are conducting this study. I'll try to pronounce the name, Bjorn Tor Gersten, and you see here their phone number, and you see here their email. So this is a personal information that you could stop the video and copy and try to send an email or try to call to find out how could you join the study. Here is another point of contact, and here is the doctor by the name Carl Henning Kalend, and you have his email here too. I had a chance to talk to this good doctor and encourage them to continue with this important research, to encourage people to look at the cryoimmunology, again, which means you do the cryo procedure first, that spills certain antigen in the vicinity of where the cancer was. There is some immune response, and I will bring in future video blogs more information about the evidence for that. So you bring the soldiers of the immune system, the dendritic cells. These cells were harvested from the patient itself and prepared to be dendritic cells. The dendritic cells are functioning as antigen-presenting cells. So they come to the battlefield where the cancer was destroyed. They try to pick up antigen from the destroyed cells and try to bring it to the regional lymph node to try to bring it to the T cells there to create new T cells that will go after the cancer. Meanwhile, there are two other approaches here to try to help the immune system, and that's the low dose of Cytoxan, and that's also the giving the anti-CTLA for the ipilimumab to try to help to take away the inhibition of the immune system. To learn more about the anti-CTLA4, you are strongly urged to look at video blogs, previous ones, which explain the mechanism, and now we just take this approach of anti-CTLA4 and combine it together with the other immune modulators and the cryotherapy. If you have any question, please don't hesitate to call me at 619-906-4700 or send an email to info@pcref.org. Stay cool and consider cryosurgery as a way to treat metastatic disease in patients that have a local area that could be treated. And I want now to expand a bit on this issue so you as patient could go to your doctor, and let's say a patient has metastatic disease to the liver, prostate cancer. There is no reason why you cannot go after the lesion in the liver, create cryosurgery of the liver, and try at the same time to manipulate and add different immune modulator, not necessarily the dendritic cell, but any available immune modulator. I had the pleasure to discuss it with Dr. James Gully, who is the proponent and the spirit behind the ProstVac. I hope that this will be approved by the FDA, so we'll have another immune treatment that we will be able to combine it with the cryosurgery. And the feeling is that there is nothing to lose to try and combine two immune treatments, because by itself the immune treatments are relatively safe. So I would like you to stay cool, stay informed, stay engaged, and have fun. Goodbye.